Good afternoon. Thank you so much for coming back. This is Saima. If you haven't met me before, I'm a nurse from Southeast England. In today's video, we are going to talk about the stress, the troubles, the problems, the tensions, and the physical trauma, physical stress, mental stress that we nurses face in the UK. And it's very easy for the people to say nursing is an easy profession. Nurses, they get loads of money, and nurses are very they earn loads of money and their job is easy. It's very easy to say than done, right? This is all we're going to talk about in the UK. This is all we're going to talk about in this video. If you are interested, please watch the video till the end. Thank you so much for coming across my YouTube channel. If you are new, please consider subscribing. I provide information about UK nursing. How can you become a nurse here in the UK? Interview tips for healthcare support workers, for nurses, for band 6 nurses, all right, and each and everything around me. UK immigration updates also, we talk about them. All right, consider subscribing if you haven't done so. Thank you so much for coming back. If you are a returning viewer, let's dive into the video without any further delay. Right guys, so I heard a lot from the people that nursing is very easy, and even back home, a lot of people, a lot of my relatives, they say, they think that nursing is a very easy job, and they can earn loads of money. That's true. Nurses, they do earn loads of money, but the stress, the trauma that we face here in the UK is different than we have in our country. Let's talk about it in a bit detail. Okay, so here, if you are working in the wards, in general medicine wards, or other sort of geriatric wards like old patient medicines or older persons ward, wherever you work in the wards, not in the ICU. In EDs, situations are different. In ICU, in ED, in day units, it's different kind of patients you get there. But if you work in the wards, whether it's a surgical ward, in a medicine ward, or cardiology ward, in cardiology, of course, you're gonna get cardiac patient, but there will be also patients with dementia and Alzheimer's and cognitive impairments. So my point to say is, here in the wards, we get loads of confused patients, loads of wandering patients, and loads of patients who have some sort of mental problem. For example, Alzheimer's dementia, if they have any sort of learning disability. Learning disability is totally different thing, but sometimes we need to spend more time with the people who have some kind of learning disability. But I have some friends, they have learning disability ability, but they are very good at their job, all right? So don't take it wrong. Learning disability is totally different thing than the mental health condition. Right, so we nurses, we have to take care of the patients who are confused, who are abusive. Sometimes they can be verbally abusive or physically abusive, all right? Sometimes they can hit you also, so you just need to be careful, right? We don't say it because they are the patients and they don't know what they're doing. It's their condition. Maybe after some time they'll apologize, or they'll say, I'm so sorry, because they can't remember. It's their memories, the problem with their memory. They can't remember. Sometimes they don't know what they're doing, so it's not their fault. It's their condition that they are in, all right? So we just need to be careful. We just need to be patient with them, all right? And so nursing is totally different as we used to do back home. It's totally different here. For example, you get 10 patients, and for those 10 patients you need to do each and everything. For example, consider you are taking care of a child, okay? You need to feed the baby, you need to wash the baby, you need to change their diapers, you need to take care of their intake, what they're taking, are they taking anything or not, are they wetting themselves or not, are they able to walk, and if they are sitting with the if they've been on the bed all the day. So these are the things you just need to think that you are taking care of a baby. It's same like in the hospital. For example, if you work in the general medicine ward, older person's medicine ward, it's the same. So we have lots of old patients there, and you are doing each and everything. So first, let's start from the beginning, from the time I start my shift. I have to serve the breakfast. I'll give them the breakfast. If someone is not able to feed themselves, I need to feed them. Then I'll be giving them the medicines. After that, I have to wash them. I have to do the personal hygienic care. I have to do the oral hygienic care. Also, I need to change their beddings, and also I'll be there to help them to sit out on the chair or on the or to take to the toilet. Okay, so these are my jobs. All right, after that, you are also going to do their observations, their vital signs. If they are diabetic, you need to check their blood sugars, right? And then it's almost lunchtime. In addition to that, if any patient is not medically fit, then you need maybe you need to give IV antibiotics, or you need to give IV fluids, or any kind of other procedure, nebulization, ECG, or you need to check their weights. You need to check their weight, all, or if they are on NG feed or things like that. So there are additional jobs for nurses, as well as they take care of their if they take care of their daily living activities, right? So in addition to the daily living activities, you are also taking care of them in with the medical view, in a medical view as well. So you are doing two jobs. You are helping them with their ADLs, with their daily living activities. On the other hand, you are helping them medically as well. So if they need any sort of treatment, you are doing that as well. So just keep in mind, nursing can be very, very difficult. Here in the UK, we do 12 hours shift. So if I have a long day shift, usually the roster is like that. You work 3 or 4 days in a week. So you start your shift from 7:30, you finish your shift at 8 o'clock. For example, I have to go to work at 7:30 in the morning. I'll be getting up around 6 o'clock. I'll freshen up myself and then have my breakfast, and I have to leave the house around 6:30 or 7 o'clock. Right, 7:30 I reach there, and then by the time I finish my job, it's already 8 o'clock. I need to wait for the bus, and after taking the bus, I reach home around 8:30 or 8:45, quarter to 9. So it's almost 9. It's almost 9 o'clock when I reach home. Then I'll be taking shower and then have my dinner with my family. So if I think about it, this is not a 12 hours shift. It becomes like 13 to 14 hours. You are awake from 6, you're gonna sleep back again maybe around 10 or 10:30 or 11. It depends on your schedule, or according to your wish, right? So it's a long day shift, but it's a 12 hour shift, but you make it around 13 or 14 hours per day. So if after one long day, you'll be mentally tired, exhausted, physically tired as well. So a lot of people, they ask me that is it good to do extra jobs? Is it good to work extra hours? Of course it's good. Obviously, if you work extra, you will get money, but money is not everything. And doing 3 days in a week, I'm telling you guys, when you are new to the country, when you are a newly qualified nurse, you are full of energy and you want to do extra shifts. And let me tell you, I've been doing that, and we can do it when we are really new. We are excited. We just want to get some extra money, and we want to earn as much as we can. But by the time you are 5 or 6 months in the trust, by the time you are a bit old in the country, you feel like it's mentally tiring, it's stressing, it's physically draining. Yes, that's true. After one long day, the following morning when I'm off, I feel like I need rest. All right, so my point to say is, give yourself enough time. Okay, give yourself time to rest, rest, give your skin some time, give your family some time, because this is the reason you are here for, to get a better life, to get a better life for your kids, and to eat well and to take care of yourself, right? So just be truthful to yourself and just be yourself, okay? Give yourself enough time to rest before you do extra duties. So if what I was saying is, if you work 3 days in a week, you will not think about it doing extra. If you want to work efficiently, if you want to work with all your passion and with all of your energy, I don't think you will be looking for extra duties. Obviously we all need money, we all want to earn more, but 12-hour shift is draining, it's long. And if you are someone who can do like who wants to do daily shifting, like who wants to do morning shift only per week, so and you're happy to work 5 days a week instead of doing long days, you can do that as well. But I consider taking a long days, 3 long days or 4 long days, and rest for 4 days. So our duty roster is like that: you work 37.5 hours per week, okay? And you do like 3-4 long days in a week and 4 long days in a following week. So if we think about it, we'll say, okay, 3 days I'm working only, 4 days I am off, which is good, but you need that time off, really. You need that time off. If you want to get yourself into work, I would say just do 1 or 2 extra shift if you really need it, okay? But if you have some goal, or if you want to some extra or not earn some extra money, I would say 1 or 2 extra shifts are good enough, okay? Some people they just comment in the comment section saying that if I'm off for 4 days, I will do 3 extra shifts. Yes, and I will take 1 day off. So they are working 3 days on their regular shifts, and she said she wants to do 3 extra shifts. Obviously you can do according to your energy level, according to your willpower. And also I would say that take this into consideration, that if you are really happy to do that extra duty, if you are really energetic to do that extra duty, I don't want you to struggle mentally and physically. A lot of people they get stress, they get burnout because of working in the NHS, like for 12 hours shift for 4 days in a week. It can be tiring, all right? And I know a lot of my colleagues, they've been getting hypertension or because of the stress. So for example, I'm doing the drug round, but I'm also thinking about, after the drug round, I need to wash the patients, and when I'm washing the patients, I have something in my mind: I need to do this, I need to do that. For this patient I need to do the blood sugar, for this patient I need to do the injection. So 10 patients per day per shift, it's difficult and it is tiring. So also because you are doing each and everything, you are washing them, you are cleaning them. Also some of them, if they are incontinent, if they can't tell you that they need to wee or they need to go to the toilet for number 2, then it's an extra job for you, okay? So it's difficult, guys. Nursing is not easy at all here in the UK. It's way too difficult. So I would say give yourself enough time to rest before you do extra bank duties. I have lots of friends, they do extra duties, they do bank shifts or overtime. It's okay if you do 5 days, like you have 3 your regular shifts and 2 extra overtime or bank duties. It's perfectly fine, because you will be resting for 2 days, so that is still okay. But I wouldn't advise you to do 6 days in a row, because I'm telling you, you need rest. Yes, you need rest. So working in the NHS is not easy, it's difficult, okay? And it's busy. You'll be on your toes all the time. For the whole good 12 hours you'll be on your toes, so you can think how it's going to be. All right, it's not only that. If I when I was back home, I used to think 10% is not a lot, it's easy, because I remember I used to work in one ward, one nurse, one nurse for one nurse for 30 patients. I used to work back home like that. So I was like, when I was back home, I used to think that 10 patients is not allowed a lot. But in my country, the nursing care is different. It's totally different. We just do the vital sign, we do the drug round, we do the what we do is blood test if there is any cannulation or nebulization or IV fluids, things like that, only the nursing stuff. But we don't do personal care. We have relatives there or any kind of healthcare assistants are available, so we don't do that sort of stuff. Okay, but here in the UK you need to do each and everything, right? And also on top of that, in those 10 patients, sometimes one patient is like independent and mobile, they can do everything for themselves, so I don't need to do personal care or oral care for them. But some people are assistants of two, where they need help of two people to roll, or they need help of two people to wash, or they need help or they need any kind of mobility help, like I have to sit them out on the chair, I would need 2 or 3 people. So this kind of stuff, like when patients are dependent on the nurses or the healthcare staff, where they need help of 2 or 3 people, then where it gets difficult, where it gets hard. So for example, I have 10 patients, and in those 10 patients, 2 or 3 patients will be independent on mobile, or 2 or 3 patients can do things for themselves. But all the rest, 7 of them, I'll be the one to do their personal care or their oral hygienic care, or their or maybe they need help in feeding, so I'll be there to feed them. So these are the things like stressing, and it takes time. So in 12 hours you are just continuously running around. Okay, being a nurse in charge also, that is a different topic, guys, so I'll make a video on that. What are your duties if you are a team leader? Okay, it's on my list. I'll make a video on that very soon. So this was all about the nurses job, band 5 nurses. What do we do here in the UK? If this video was helpful for you, please give it a big thumbs up. I'll see you soon in the next video. Till then, take care. Bye bye. God bless you all.